We are live.
Good evening, all. Welcome to iFocus Online. It feels good to wriggle out of our burrows, back onto the turf familiar to us this monsoon, to the petrichor of rain, to the lecture 431 by none other than Dr. Honavar, to speak to us from the slides to success, decoding the DNA of impactful presentations. Over to you, Dr. Honavar.
Thank you, Sabha. I think it's a welcome break that we have from the toxicity of cataracts. And today we'll use this time usefully to talk about something that is very important for us, how to create presentations and make presentations. This I learned over a period of time, and I'd like to share what I have learned with you. But of course, there'll be many things that still can be learned by anyone at any point in time. It's a myth, actually, that knowledge and talent speak. That's not the reality. The reality is that knowledge prepares and presentation speaks. And that's very important for us to know. Even if you know everything, if you don't present it well in a way that the audience relish it and take it home, then your presentation, then your knowledge is actually not going to be of any impact to anyone. These are two superstars, right? They look good, maybe in a character role. So what matters is presentation. Even if the science is indisputably great, what really matters is how they dress up themselves. Look at the difference that it's made to her, Deepika Padukone. Just the presentation that matters. You may have excellent material to present, but if your presentation material that you used to present it and the way you present it is not good enough, then it really doesn't make any impact at all. The basic information is that presentation is an art, and it is like telling a story. That's how it is, really. Not this lecture, of course, this is more instructional, but a routine presentation is like telling a story. You have to make up history, you have to make up a story so that the knowledge is passed on. And it is also true that every seeker of knowledge is a child at heart, at whatever age he or she may be in. If you really want to seek knowledge, you have to be a child at heart. If you're an adult at heart, then of course adult hearts are opaque and they don't really respond much. It's also said that storytelling is magic. Say a few words, cast a spell, and the magic unfolds. Also, the goal of a great presentation is to create emotions, emotions that last, that make an impact, that will change the way you practice medicine, that will change the way you approach the next patient that you see, all that. So the most important goal is also to persuade listeners to take action, in the sense that if they are doing a management in a particular way, and if you teach them a better way to manage a particular patient, then if they make that change in their practice pattern, then actually that's an impact that you have made. You made them to take an action, and your presentation may be the shortest route from your mind to their action, and that is the impact. So whenever you create a presentation, there are three stages. First is to prepare a presentation, second is to design a presentation, and the third, of course, is to deliver. I'm not good at delivering, but I may be able to tell you about preparation and design of a presentation. The beginning of the beginning is to prepare. It said that story is the skeleton. And a good story is supposed to be very simple. It's a quote that if you can't explain it simply, then probably you haven't understood yourself. So if you can explain any complicated concept very simply, that means that you have taken time to understand it yourself. There are 10 tips that I could collect. First is to turn off your laptop and conceptualize in your head. Start with the end in mind. Whatever is the information that you want to convey, one single sentence or one single theme or one single chain that you want them to practice, that is your end. You start with the end in your mind, close your laptop and think of a concept. Of course, know your audience. Now, I'm doing this lecture online. I don't know who are my audience. I assume that most of these are postgraduate students, residents, and fellows. That's fine. But if you don't know your audience, then there is a problem. Now, if you already know your audience, you can create your presentation to meet their requirements. Some of the audience may be like this, experts who will be sitting in the front row of any conference, and then they'll bombard you with questions because they have fixed practice patterns and they may not accept, or what you present may not be palatable to them. So you have to tailor your presentation to the audience. And in the digital era, you should really know who your audience are. Next is to plan a solid structure. Content is very important. Said that content is the most important aspect of any presentation. Any story needs an architectural structure, which is completely forgotten once you see the movie. If you see a movie, you forget what is the structure about. You relish the movie, but here again, simply, once somebody sees your presentation, they won't understand what is the skeleton on which it is based, but you know what is the skeleton. For example, if you're talking about a disease, say you're talking about neovascular glaucoma, or even for that matter, let's give the example of myasthenia gravis. You have to define the disease. You have to define the or mention the diagnostic criteria. You have to give out what imaging modalities would you perform or what tests would you perform in a particular patient. In a patient with bilateral severe ptosis, if medical management fails, what next? Is there any role for pathology at all? What is the prognosis in such an individual over a period of time? And finally, conclusion. So whatever is the topic of your presentation, you have to plan a very solid structure or subheadings based on which you will construct your presentation. Then what is the key message? Again, going back to myasthenia, surgical management is definitely not advocated as a primary management in myasthenia. It's always about medical management. Only when medical management fails in a refractory situation, or when medical management cannot be given, maybe you would consider a pair of crutch glasses. And then if at all nothing works and if a patient is very severely visually incapacitated, maybe you would just shift the palpebral fissure up so that the patient's pupil is exposed, that kind of a thing. So what is the key message that is to be given in every topic is what is important. And what is that one thing that you want the audience to remember? If you're talking about OSSN, you would, and medical management of OSSN, you wouldn't want them to remember about, say, the basics of 5-fluorouracil or mitomycin. You would definitely want them to remember about the fact that mitomycin or 5-fluorouracil or interferon should not be used in a patient who has an invasive squamous cell carcinoma. Topical therapy does not work in such situations. That is what you want them to remember, so that they don't start this treatment in such a situation and experience failure. And whatever that is included in a presentation must be included with a good reason. Again, it is said that if you say in the first chapter of a book or a story that there is a rifle hanging on the wall, in the second or the third chapter, it absolutely must go off. If it's not going to be fired at all, then it should not have been hanging there. You should not have mentioned about the rifle at all in the first chapter. If you're not going to use it again in the story, it's not a decorative piece. You should hook them very early, grab them and never let them go. You should always start with a bang, a mind-blowing case or an interesting story to introduce the concept and build on it. Suppose you're talking about proptosis. You can start showing a case, explain how a particular patient presented, ask them for a differential diagnosis clinically, then perhaps show a CT scan and an MRI and ask them to correlate clinico-radiologically, then show them the surgery that you did and the pathology and ask them to do a clinico-pathological correlation as well. Then you explain about the disease in detail and rest of it simply follows. Demonstrate a clear change. A presentation that does not seek to make a change is a waste of time and energy. If you're simply making a presentation to give out some information which is already known, then it is of no use. So to mix information with some aspects that would elicit inspiration and motivation to change in practice. Change is not from wakefulness to sleep. You know who are these audience, right? So obviously they are asleep because They have no reason to be awake. Your presentation should not be like that. The audience should have a reason to be awake and listen to your presentation. Tuju, what is this? You can stop your presentation and ask a pertinent question, maybe an impertinent question, just to wake up the audience. Ruju, what do you think is this?
So this is bare orbit sign.
Mhm. Now Ruju is awake suddenly because she now knows that one more question may follow. And also Ashwita and Farnaz and Subha will also be awake now because they don't know who the next question will be addressed to, right? So you can ask a particular question, relevant or irrelevant, absolutely nonsense even, at some point in your presentation or at many points in your presentation to keep the audience attention. So you can ask an open question like I asked or specific question aimed at a particular person in the audience. Take an audience poll or show a very dreaded complication, something that happens all of a sudden, like bleeding or expulsive hemorrhage, or show salvage from a totally given up situation like this. Or create emotion. Child suffering from orbital retinoblastoma doing so well after multimodal treatment is something that would create an emotion in you. Okay, there's, it's good to manage retinoblastoma and get this kind of an outcome. So make them feel that it is good to invest your time and energy in managing a complicated clinical situation and get gratifying results. So it will make them emotionally connected. And be authentic and humble. Honesty is the key. Acknowledge all the resources from where you have collected this knowledge. Authenticity is built on honesty and a willingness to be vulnerable. If you're wrong, admit it. If you don't know an answer, say that, well, I'll check and get back to you. Honesty is rare, and it is appreciated when found. Never bluff an answer because obviously the audience are going to go back and check whatever resources they have and they'll find out that you bluffed them. That's not really right. Next aspect is design. If story is the skeleton, visuals are the flesh and skin. So you have to include visuals in your design. Now, what template do you use is the question that is often asked. In PowerPoint, there are various templates. In any PowerPoint for that matter, these are the templates that are already built in. You can also buy a set of templates. These are commercially available. You'll have thousands of templates that are at your disposal. But in medical presentation, it's not good to be complicated. You should always use a very simple template or build a template or create a design of your own. But whenever you create a design, make sure that there is some consistency. Example, I'm creating a set of slides on evaluation of orbit, and I'm creating another set of slides on radiological diagnosis of an orbital pathology, then one more set of slides on the management of an orbital pathology. Now, at some point in time, I may have to use all these three sets together, right? If one set is of a totally different theme, the diagnosis is of a totally different theme, and the treatment is of a totally different theme, then I'll have to sit overnight and then change the theme or try to create some kind of a uniformity. Otherwise, I'll be jumping from one design to another when I use all these slides together. So if you have some kind of a long-term business in mind, that means that you're going to be in business of public speaking or presentation over a period of time, it is always necessary to have consistent design so that you don't have to change the design to merge a set of slides that are belonging to different presentations. So consistency is the key. You have to create a design for yourself. Most of my slides either have a black or a white background. I purposely keep that so that I can pull up 6 slides from one particular presentation, pull 12 from the other presentation, and make a very seamless set at very short notice. Right? Okay. Now the format. 4:3 format is almost given up. It's no longer used. 16:9 is what is used. But if you're using, for example, a projector and a screen, 4:3 is still useful. If you use 16:9 in a typical screen, which is a hanging screen or a overhead screen, then what happens is that they will condense it. They will make it small to occupy that screen. It will not occupy the full screen. So your presentation may look smaller. So depending on what kind of situation where you're presenting, you can change the format. But currently, For all LED screens, 16:9 is the format. In fact, many of the conferences insist on having a 16:9 format. Now, what about the background? You can have choices. I would prefer monocolor for sure. One color, black, dark blue, dark gray, whatever you want to choose. To that, add a design element. What is a design element? Very simple. This white 2 in a blue background is a design element. This change in color for the heading is a design element. If you simply use a line here or a small design here or logo here, that is a design element. You can use standard template on PowerPoint, as I already mentioned. External templates are purchasable. Some organizations or institutes have a fixed template. For example, if you work in an organization which is of national or international repute, they would supply you with templates which are supposed to use, and you have to comply to those requirements. So I so far said that I would prefer single color, design element or a highlight is okay, and keep it the same across your presentations at least for a few years so that you are able to mix and match those presentations. This is black and white with yellow as the heading. Now I've changed it to blue. It's very pleasant. You can use blue as your very pleasant background, blue. But you see here that the title and the bullets are matching. I'm not using red here, right? That would be too much of color within a slide. So this is good. You can also use this particular color, white as the background. Now I have used dark blue as the heading and the bullets are matching blue. And this line is slightly lighter than the heading in the bullet. This is also perfectly all right. Very simple design, quite elegant, and the font is Arial here. We'll talk about the font size, etc. a little later. That's little different. See this? This comes across very bright and nice, very positive. Black is not bad at all. Black stands out very beautifully, although it may not be as bright as white. So you use white or black or blue. These are my preferred colors, and you may have your own preferred colors. Now, what about the logo? Now, if you use this kind of a logo at the bottom, it looks little jarring. It takes the attention away from your presentation. Always keep the logo at the top or bottom, left or right, whichever side you prefer. Don't watermark your slides. I know it is a concern that people take pictures of your slide and your slides may not be given credit when they reproduce those pictures. But despite all the risks that you have in showing pictures, don't use too garish watermark, because that will take attention away from the text of your slide or the picture that you show on the slide towards the watermark. Right? So if you have to use a logo, you would use like this. This is called a PNG image or portable graphics format image. Any JPEG image can be easily converted to a PNG image in which the background is transparent. You can use a PNG image on any sort of background and it will appear white or yellow or blue, whatever is the basic color of the image. So you can use a PNG image and keep it to the bottom, and you can make it smaller than what I have shown here, like this. This is again a PNG image where the image is blue and the background is white and it merges with the background of the slide. So this is more comforting than this, isn't it? Don't you agree? Right? More comforting, definitely more comforting. So you have to use the logo to match your background. The next is about fonts. Use good fonts. Now you have to know the difference between serif versus sans serif. We also should know about the font type, how to or when to use multiple font, what should be the font size and the font color. We will discuss these aspects next. Serif and sans serif are two different families of fonts. Serif is mainly used in prints, such as newspapers, because small fonts in newspapers are easily recognizable. It looks more elegant in small print in newspapers. Serif always ends with a flourish like this. That's a typical serif font, and the top is always pointed. Sans serif simply ends. It does not end with a flourish, and the end is either rounded or blunted top. So there is a difference between serif and sans serif, although they may look almost similar, but the impact is more different. Sans serif is clear when you use it in a presentation. It does not take attention away from what you're speaking or what you're showing, whereas serif makes it busy. That is from the perspective of those who view your slide. The font families in serif are Times Roman, Georgia, Rockwell. These are the popular serif fonts. You can use serif, but personally, I would prefer sans serif. Arial, Vardana, Trebuchet are sans serif fonts. These are at the drop-down menu in PowerPoint, and you can choose any of them. But always make sure that you maintain the same font all through your presentation. And if at all you use multiple fonts, then that should be with a purpose. You cannot simply use fonts like this in a particular slide. It will make it erratic. It can be used for emphasis. For example, one particular word you can change the font, or the heading you can change the font, and that will emphasize what you're saying. But don't randomly change the font all through the slide. So again, I recommend Arial, Verdana, Tahoma, Helvetica. These are my favorite fonts as far as the sans serif fonts are concerned. Now, what is the font size that you're supposed to use? I have shown various font sizes here. Obviously, 60 is very big. 40 is acceptable for a heading. 36 is good for the text. It said big is beautiful, but the test is a 2-meter test. If you use a 14-inch or a 13-inch laptop with a full screen presentation on the laptop, if you sit at a distance of 2 meters, it should be readable. Then it will be readable by the audience sitting in the auditorium, depending on what screen size they have. Obviously, screen sizes in an auditorium are designed to the length and breadth of the auditorium, and if they have reasonably done so scientifically, then it should be visible to the last row. So this is a 2-meter test that you can do. But having done that test, I would say that ideal font size is 36 or 48 in Arial. It could be a little different if you use a different or a more compact font family, right? So basically, I would use 48 for the heading and 36 for the body of the text. Now, there's a great disparity here. Heading is too big, isn't it? And the body of the text is small. So you should not have such a huge disparity. Here it is reversed. Heading is small and the body of the text is large. That is also bad. So ideally 48 for the title and 36 for the body. All right. Next is font emphasis. Italics are difficult to read in a presentation, and underlines are typically used for hyperlinks. If you're showing a website URL or an email that the audience need to contact you to, or if you're using a hyperlink in a presentation, from one slide, you're going to jump to another hyperlink presentation or a PDF or a Word file or whatever you have, then a hyperlink is used. And whenever something is hyperlinked, it is shown in blue. But otherwise, underlines are not supposed to be used in a slide. Normal font are generally used. You can use bold for emphasis and also color for emphasis. So basically, I say that italics are not to be used ideally. All underlines are supposed to be hyperlinks, and that's supposed to be in blue. You can use random bold in a slide or random color in a slide only for emphasis. Right, like here, I'm using yellow only to change the color of this word color, and that's only for emphasis. Bold here is for emphasis. Rest of the font is all normal. So you should use bold and color with a purpose, not randomly. Now, text spacing. Many times you see that the text is very widely spaced. This is disturbing. Text space can be changed in PowerPoint. Narrow is very difficult to read. And the gap between the lines, if you have double spacing, it is distracting and appears disjointed. You can use some kind of a change in style to represent a change in concept, but I would say that spacing of 1 is fine, or 1 to maximum 1.5 and 1.2, 1.3. You can select the spacing between the lines in PowerPoint, but always leave space between the fonts normal or 100%. So I say that space between the font should be 100% and space between the lines should be 1 to 1.5. You can go up to 1.2, 1.3, 1.4 or even 1.5, but 2 would be too jarring. All capitals are rude and are difficult to read. So don't use all capitals at all in any slide. Sentence case is best for bullet points. Sentence case is when the first letter of the sentence or the phrase starts with a capital letter and everything else is a small letter unless you have, for example, a name. If you use Ruju in the slide, you capitalize R. Otherwise, it is to be sentence case for all bullet points. Title case is best for the heading. In title case, each relevant word in a particular sentence or phrase is capitalized, except for words such as is, for, the are never capitalized. There are rules for how to use a title case. This is a basic editorial concept that you can refer to how to use a title case, but title case is best used for a heading. Now, if you were to use title case for the body of the slide, then again that would be distracting. So remember, sentence case is best for the bullet points or for the body of the slide, and title case is best for the heading. Colors are nice, but don't use too many colors. You can use a different color for the heading and a uniform color format for the rest of the body of the slide. So yellow on black is very good. Black, blue, red, orange on white is also good. That's for the heading. For the body, I would prefer personally white on black or black on white. Now this is just for you to check which looks better. There is no doubt that this looks very pleasant, white on black. Yellow draws attention. Orange also draws attention. Red screams. It does draw attention. You can use it to scream a particular concept. You can use it very occasionally. But blue on black is really not good. Gray on black is okay. If you want to hide a particular portion of the text, if you want to hide the top 5 bullet points and emphasize on the last 6th bullet point, you can make them gray. But otherwise, it's not a good idea. Brown is not good. Green is not good. So from this, you will yourself understand that white is very elegant, yellow is good for emphasis, orange is okay, red actually screams and you can use it sometime. But if you have white as the background, look at this. Blue looks very nice, gray looks good, black looks good, red also for some reason looks good here, green looks okay, yellow is a no, orange is a no, brown maybe. Right? So, I mean, this is just a suggestion. It depends on your sense of aesthetics and how you want to create it. There are two types of complementary colors and contrast colors. Complementary colors are bad for text. I wouldn't suggest that you use complementary colors. So you should always use contrast colors. Contrast colors always stand out than complementary colors. So this is a chart that you can get on internet or take a screenshot of this slide. What are the contrast colors and complementary colors? But basically, you would suggest contrast colors, black on yellow, yellow on black, black on white, white on black, black on orange, orange on black, blue on white, white on blue. These all look very good. So you can use any of these permutations and combinations. So colors are not nice, but contrast is your friend. So colors are very good. You don't have to be splashing all the colors across your slide. Use contrast colors. They really carry your text matter across to the audience very well. Now bullet. Bullets are to show priority, sequence and hierarchy. You should not use a fancy bullet. You can use a square bullet or a round bullet that I would prefer. Generally same color as the heading, and you should configure the bullet to have 100% font size, and there has to be a distinct gap between the bullet and the beginning of this text, which is about 3 millimeter on the scale in the PowerPoint slide. So you should offset to stand out. That's what I mentioned. If the points were to start right next to the bullet, then that will not be good. You should always leave a gap of 3 to 5 millimeter. And if you are showing a, say, steps of a particular surgery, here I am showing steps of ocular surface squamous neoplasia excision. Here, it may be important to show it as a numbered sequence. First step is excision with tumor-free margin. Second would be alcohol-assisted carotid epithelectomy. Third would be cryotherapy to resection edge, and so on and so forth. So use numbers for sequence if you are describing a particular procedure. So in summary about the fonts, keep it simple. Use sans serif font. That means that fonts which end with a rounded end and have a flat top. Use the same style all across your presentation unless you want to change the font to only emphasize. Adequate size, we said 48 is good for the heading, and 36 is good for the body of the text. 2-meter test also you have understood. Use contrast color rather than complementary color, and you can use sparingly bold and color for emphasis. Never underline unless it is hyperlink. To try not to use italics. Next is how much text is too much. Some of us cram the slide with lot of text and you try to read out what is in the slide. It means that you're simply reading out the slide to the audience who themselves can read it. Your presence is inconsequential if you're going to read out the slides always. Sometimes you have to read out definitions, diagnostic criteria, etc. But otherwise, generally, you're not supposed to read out. So you should not fill the slide with a lot of text. You should use text to take cues so that you rest of this talk should be impromptu or practiced orderly talk. What we have is a 6x6 rule, which means that you should have not more than 6 words per line and not more than 6 lines. Anything less than 6, you tend to see from the physiology perspective. Anything more than 6, people start counting. In fact, it is known in research that anything more than 6 takes 500% more cognitive power and effort. That means that you have a risk of incurring death by PowerPoint. If you have too much text, the audience at some point would have used 500% more cognitive power to decipher your slide, that at some point they will either take their attention off your slides and pay attention to their mobile screens, or to their neighbor who is sitting next to them and catch up with some gossip, or they will simply sleep. That's called death by PowerPoint, right? So your presentation is going on, but nobody is interested in your presentation because you have bored them or you have exhausted their cognitive reserve. Next is about text arrangement. Very important. Always maintain a level which is fairly uniform and no abrupt jump. See this. Can you see this? Look at how the text is jumping here. Would that be good? You can use it to wake up an audience, but this is really not good if you were to keep on jumping in level. So your heading should always start at a particular level, and your body of the slide should always start at a particular level, never jump. So we talked about the text arrangement. Now let's very briefly talk about flowing text and using bullets and text as graphics. This is not advisable at all. You should never use flowing text. Even if it's a definition, try to break up the definition into bullet points, and when you speak, you can speak it as a continuous sentence. Never use flowing text. So finally, about the text is evil. Never have more than 6 lines in a particular slide, and never use more than 6 words in a particular line. And except under exceptional situations, if you really have to use 8 words in a line and 8 lines in a particular slide, that is okay as an exception, but not as a rule. So I can show this particular slide. There's a picture of OSSN. I am saying here it is the most common tumor of the eye, including intraocular, extraocular, orbital tumors. Most common tumor is the tumor of the ocular surface, and most common ocular surface tumor is OSSN. It has a clinical spectrum consisting of dysplasia, carcinoma in situ, and invasive squamous cell carcinoma. So there are maybe 1 8 words here. That's all in this slide. But this conveys almost everything about ocular surface chemistry, please. So limit words on your slide and let the picture speak. So this picture is going to make an impact on the mind of the audience. When they see this kind of a clinical situation next, they'll think of OSSN. But if this picture were to be very small and the text were to be very large, then you have taught them theory, but they may not be able to recognize OSSN when they see it next. They'll have to remember the theory and fit that theory onto a particular lesion that they're seeing to be able to diagnose. But when you give them such a bold, prominent picture and some text to go along with it as keywords, then that is easy teaching. Let pictures speak and don't make people read too much. Let them see and learn. It's also said that images say more than 1,000 words. That is true. I can hear with this slide say that diagnosis is difficult, keratin helps in diagnosis, and it is present in 70% of cases. I can say that here. I can simply say this. Keratin, 70%. Which one do you like, Ruju? This one or this?
Second one, sir.
Right. So what did I say? I said, this is good, fine. Okay. But you can be even minimalistic. This is also good. Exactly on the lines of the previous slide I showed and described it as good. But this is even better. Why am I doing this? It's because I want to emphasize on keratin here. I don't want you to learn anything else on this slide. Keratin, maybe abnormal vascularity, which I would point out on the screen. Maybe I would point out on Rose Bengal staining. That is all I'm going to point out here. I'm not going to talk about theory at all here. Keratin is an important diagnostic aspect of OSSN. That is all. And that will remain in your mind probably for a week more than otherwise if I were to use a text busy slide and a small picture. Now, this is the rule of thirds. What do you think it is? Why am I showing this? Subhav, you're good with pictures. Can you tell me what is this trying to emphasize?
Basically, even if you like describe a face of an individual or an image, it follows that rule of thirds.
What is it?
It is about proportions.
It is about proportion. Now look at yourself. You're sitting in front of a screen. How have you positioned your head? You're positioned your head right in the center of the screen. I'm not sitting like this. Neither am I sitting like this. Correct? I've positioned myself because I know that I'm going to be on YouTube. I've taken pains to centralize my camera and I'm sitting right in the center of the screen with a little gap between the edge of the slide and my head and almost equal amount of gap between my chin and the bottom of the slide. This is subconscious. You haven't, purposely measured all this. Exactly similarly, you have to position the picture in the center of the slide. The point of focus, the attention. Here, what is it? This is a mountain with a peak. Peak is the point of attention here for some reason. So to put it in the center square of the rule of three. So this is the area where the most important part of your picture should be. That will draw attention. You can put it on slide. Sometimes for artistic reasons, you off-center a particular picture. That is okay. That is not as a routine. You have to, whatever that has to be important or should draw attention should be in the center, like this. Here I am showing a choroidal melanoma with fluorescein angiography with double circulation. What am I going to emphasize here? This. That is right in the center of the slide. Correct? So sometimes what happens is when you get pictures from the photographer, it may not be well centered. It is your business to crop the pictures and make sure that the point that you want the audience to focus on should be in the center as far as possible. Slight off center is okay. I mean, you can't always be perfect, but as far as possible. Or show before and after images. Here, what am I showing? This is a patient with thyroid eye disease, and we have treated the patient with intravenous methylprednisolone and azathioprine. Now, if I just show the patient's face or even ocular motility, that may not make much impact. Audience may not be able to appreciate that subtle difference in ocular motility. Or if you say, well, I treated this patient with IV methylprednisolone azathioprine, the patient was free of diplopia. You have made that statement. Audience has to believe your statement. It all depends on what kind of authority are you and how much do they want to trust you to change their practice pattern to start a immunomodulator along with steroids. Would they trust you so much? If you simply make a statement, may not be. But if you show a picture where the inferior rectus is that big and it becomes so small, they'll be able to trust you because you're showing an evidence here in terms of pictures. This is not an article that you have written. Hardly any ophthalmologist would go back and read an article unless they are really focused in it. But here, your point of impact has been made because now you're convincing at least maybe 10% of the audience to change their practice pattern to start multimodal treatment in a patient with thyroid eye disease where there is active disease and diplopia in primary position, right? So generally what these patients are treated with, majority of ophthalmologists or not oculoplasty surgeons would have treated these patients with oral steroids for 6 weeks and that's it. Oculoplasty surgeons would have treated them with oral steroids, slightly higher dose, more prolonged, perhaps with intravenous methylprednisolone, not spaced out. But if you have focus on thyroid eye disease, you know the pathology of the disease, you know how they work, you would start them on multimodal treatment or immunomodulators at some point in time where the patient really needs it. And that point has been made with this slide just by showing this picture. Nothing else has been said about it. So pre and post pictures are very important to draw attention. Like this. I can give a lecture or I can show my published article on plaque brachytherapy in OSSN. But if I show this slide, then it is for the audience to decide then and there that at least in certain situations where there is scleral invasion or corneal stromal invasion, brachytherapy in OSSN can be eye saving and vision saving. There is no argument about this particular slide. Well, there could be 80% success, 75% success, 72.33% success. That is for later. But now you have convinced your audience who are sitting in front of you at least to refer patients when there is a scleral invasion and not do orbital eccentricity, right? So pre and post are very important. But don't show such a small picture. It is of no consequence. Nobody will be able to make out the details of such a small picture. Show this. Size implies the importance that you're giving to a particular picture. I love big pictures and very few words. And if at all you want to show something, put an arrow. All right. So focal points draw attention, such as an arrow, but the picture has to be big and it should fill the screen, and there should be just 3 or 4 words on that screen for you to draw attention towards that particular thing that you're showing. Next is about infographics. You don't have to always stick to those graphs which are routine, bar diagrams, etc. You can always use innovative infographics. So this is very simple here. All I am showing is that improvement in exophthalmos more than 3 millimeter or equal to 3 millimeter happened in about 60% of patients. So all I'm going to say here is not all this. This is given just for information. I'm just going to say that exophthalmos improved by more than 3 millimeter in about 60% of patients. And this infographics is quite representative. When you're going to talk about, say, in one slide summary of the management of active thyroid eye disease, you can use a schematic like this or a flow chart, right? So, but you'll have to spend a lot of time explaining this. This is not that, okay, just show this and move to the next slide. Here, I would spend at least 5-7 minutes explaining this, how you move from one line of treatment to another by stopping at each point of divide. All right, so we talked about all this. Graphics and art should be relevant, simple, and non-distracting. And wherever it is used, you should use innovative graphs than the bar diagrams. What was that? Is that good? You will feel good about it, but the audience may not feel good about this animations, right? And also, if you have a time-bound presentation, 5-minute presentation, and if you have a lot of animations, and if you're using a vendor's laptop and not yours, and if he's using a corrupt Windows or a Windows, which is kind of a fake Windows or a software which is it's not licensed, then or the RAM is not good, you might be stuck with your animations. You'll not be able to move forward. Your animations render very slowly and you may be stuck with it, and your 5 minutes will be over before you complete your presentations. Use transitions, but not animations. Minimize animations. Include only if deemed really necessary. For a long lecture, you can take the risk of animations, but for award presentations, time-bound presentations, try not to use animations. Even if you use transitions, avoid fancy transitions. Appear and disappear. Like this is appear and disappear. This is best. This is not good, right? Yeah. So be consistent. Summary is this. Use differences to draw attention. Use differences to imply importance. Use surprises to attract and not distract. Has that sunk in? Hopefully so. Okay, like this. I'm consistent here. My bullets are square, but I've used this only to draw an attention towards you. That particular point is differently bulleted. Use differences to imply importance. That something in orange is the word that you must catch in this otherwise relatively busy slide. Surprises. I would never use green and red, but I've used it. This is to attract your attention to these particular words and not to distract you. This is done very, very sparingly, maybe in one slide in your entire presentation. Be effective. Text to support communication, graphics to simplify concepts or to emphasize a particular statistic, pictures to show and teach, right? All these big pictures of tumors are to show and teach. Videos are to be used to do and show. Animations and flowcharts to break down complex concepts, and visuals and differences to attract and not distract. The last point, be effective, be big, be simple, and be clear. So finally, the 10th point is that make it actionable. Whenever you present, give a learning point, a take-home trick. If somebody was not doing alcohol-assisted keratoepithelectomy and had 20% recurrence, you have taught him a point that, okay, this is a simple measure, doesn't cost anything, and it will reduce your epithelial recurrence to less than 2%. He has taken home a point in which he may use tomorrow. If you have shown them a difference between recognizing a nevus and a melanoma, conjunctival nevus and a melanoma, next time he sees a nevus, he will not get worried and he'll not rush the patient to surgery. Next time he sees a melanoma, perhaps he may treat it with a lot of respect that it deserves. Something of immediate practical importance, something which you would see or he or she would see in the next week following your presentation, something which is as common as that, and also would stimulate to improve knowledge and skills. If you say talk about a particular surgical innovation, maybe he would go and read about it. He or she will see a lot of videos and then try to incorporate that in his clinical practice, or at least know the limitations when not to particularly treat a patient. Say a patient with a orbital apical tumor, which is impinging on the optic nerve. Try not to rush to do orbitotomy and try to excise the tumor rather than maybe do a good MRI, learn what it is, maybe have a frozen section diagnosis standing by, and venture on to do an incisional biopsy if you think that it cannot be excised without losing vision. So you know the limitations. All right. So presentation is something that should catch the audience attention and wow them. If you see a lot of drop jaws and open mouths, that means that you have really made an impact. But ultimately, simplicity is the ultimate sophistication, right? If you see those expensive cars, they're not too high on chrome. They're very simple, well designed, not too many sharp lines, not too many LEDs, but they show sophistication. So simplicity is the ultimate sophistication. Your design should be simple, content should be intense, not in the number of words, but what you speak must be of some impact and it should be intense. And finally, when you deliver, going back, story is the skeleton, we said, visuals are the flesh and skin, we talked about, but the delivery is the soul. How you use all that you have created to, why is that expression, Ruju? All that you have created to deliver what you want to convey, whatever your thought about your particular presentation. Well, today I wanted to teach or at least discuss how to make a better presentation than we are already making. If I'm able to convince you to do that from your next presentation onwards, then I have been effective. But if I have simply shown my beautiful slides or not so beautiful slides, and you're just there on the screen or looking at it just because I am presenting, not have learned anything from it at all, and tomorrow you go back to your own set of slides and say, why do I have to change? I'm doing great. Then I'm not good enough. It's a 1 hour waste of time for me as well as everybody else. If there are 500 viewers to this presentation, then we have collectively wasted 500 work hours, which we could have used to maybe change the world, right? Okay. So whenever you speak, well, I'm not good at that, but for the sake of completion, let me go ahead with the next few slides. People should be focused on you and your presentation, and they should be excited about what they will learn from your presentation. And you should have the SMART goals: specific, measurable, achievable, relevant, and time-bound presentation. Your slides are not the point. You're going to deliver those slides. So you are the point. You should be confident, comfortable, and considerate, right? If the lecture hall is warm, make sure that you beg to reduce the temperature so that you don't sweat. You should not come across very strong like this when you're on the podium. People don't like it. They don't like over emphatic presentations, over emphatic presenters. They don't trust them because they're extraordinary. No man can have a body like this. No ordinary average man, average guy can have a body like this. These are extraordinary. Nobody trusts the extraordinary. Nobody will think or will probably mirror with you in the sense that they're sure that they cannot build a body like this. But this is something which is good, right? Vulnerable. We all curl up. Be naturally vulnerable. If you're sweating, that's okay. If you have to use your handkerchief, that is okay. If you stumble on words, that is perfectly all right. If you have to repeat your sentence again to make sense, that is perfectly all right because you're vulnerable. You're coming across as one of the audience. If the same person in the audience were to come and speak, you would make the same mistakes. Correct? So vulnerability creates comfort and credibility. Then the audience will start trusting you. And if you're making a point or making sense, they'll probably start trusting you and start practicing what you have taught them. Most important, be comfortable, whatever dress that you wear. But the most important point in being comfortable is that you have to practice it. Even the greatest of speakers have a habit of recording their presentation. If you have a very important oration to deliver and you have only 15 minutes to impress a crowd of 2000 who are in the hall, in American Academy, if you have oration, you'll probably have what 1,800, 2,000 people sitting there, Jackson Memorial Oration, and you have 15 minutes or 20 minutes, or even otherwise. This, if you have your first podium presentation, even in a midterm conference of AIOS, in a big hall, there'll be 400, 500 people. So I expect you to have practiced not once, not 10 times, but until you are comfortable in delivering it within the 8 minutes that are allotted to you and make an impact on those 400 people that are sitting there. Maybe 2 or 3 out of them would themselves conduct a conference, and maybe they would choose you as their speaker at their next conference. That is how you get a break in the podium, right? One leads to another. So you have to practice, you have to record your presentation, listen to it, and make changes in your diction, the way you deliver it, gaps, pauses effectively. Now it's very simple to record PowerPoint on screen with your face being shown, or just go to Zoom and do the same recording yourself. Listen to it, time it, and be comfortable. So if you practice your presentation in the wildest of circumstances, you'll be comfortable. Always take the audience to the bottom of the subject. That means that you have gone very deep into the subject, but don't leave them gasping there. Finally, when you conclude, you have to bring them back to this pleasant surface and leave them breathing on the surface. So don't take them to the depth of the topic and leave them there and end your presentation. You have to always give take-home points, bring them back to the surface, and be mindful of time, stick to time, and leave time for discussion. Don't chew away other speakers' times. Suppose it's 8 minutes. If you take 10 minutes, the next speaker will have only 6 minutes. And if that keeps going on, the last presentation has to be cancelled, or the next session will start late, etc. Never eat upon others' time. And finally, one idea per slide. Use text. Remember the 6x6 rule. More images, big images. Remember the 9x9 grid. The point of focus should be in the center of the slide. Use dark background. Contrast is your friend. Size matters, 48:36. Number of objects in your slide matters. Number of slides don't matter. This is not 124 of 127 slides. It's actually 154 of 156 slides I had in this presentation. Number of slides don't matter actually. What matters is number of objects on your slide. So I tend to use a lot of slides, a lot of big pictures, very few words. Good is everywhere, but magic is rare. Thank you so much. So if you have questions, I'm sure you have a lot of questions. I'd be very happy to answer.
Thank you so much, sir, for that wonderful presentation. Over to Riju for all those questions.
Thank you so much, sir. It was a great learning experience. Till date, I get anxiety and palpitations at the time of presentation, but I guess this would help a bit. And any questions we have got from? So-
It's okay not to have questions.
Chat box is empty. Mind box should be full.
All right. So any of you have any questions? Arvind?
Excellent presentation as usual, sir. It's always a treat to see your presentation. So what if we want to include the videos in it?
Yeah, sure. Videos, I said, should be included whenever you are showing a clinical examination, particular set of clinical examination that you want to teach. Say ptosis evaluation. If I want to show them how to measure LPS action, I would perhaps take the help of a video, and even steps in surgery. But video should be well edited. You cannot start forwarding the video from the podium, unless you are really rushed. There are very good ways to edit, and even in PowerPoint, you can start the video at a particular frame. You don't have to show the entire video. So video should be very crisp and well edited. And videos are a great addition to any presentation. In fact, you can make a presentation only with video. If you're showing a particular surgical step or a particular surgery, the entire presentation can be with a video with pauses and some slide and text interposed somewhere. But that's perfect way of presenting.
And what regarding you are saying the whole presentation can be video based only. So regarding the voiceover, so how that modulation needs to be
Voiceover
there?
is not taken well. If you are standing at the podium, you might as well speak, not have somebody already voiced it over, and you just stand at the podium and look at the audience. Then they might as well watch the video. It is all about eye-to-eye contact. When you speak from the podium, you would have made eye-to-eye contact with several in the audience, and that is how you kind of convey something. They would be looking at you, and you look back at them, and when you make a point, that person actually pays attention to what you're saying. When you have a pre-narrated presentation, that effect is lost.
Absolutely, sir.
I have one question. Any effective or attractive way to present a review of literature slides?
Review of literature, well, I mean, you should just use, very minimal data. There are presenters who would say 96.67% this happened, 38.23% that happened. Well, that is inconsequential. You can simply say majority of patients had this outcome, 1/3 of patients had adverse outcome. That stays. Round it up. Instead of saying 78.3, you can say 80%. You're not saying anything wrong. 80% stays in the mind. That is what you want to convey, right? 8 out of 10 patients do well. That's all you want to say. Instead of saying 79.3 out of 1144 patients, that doesn't make any impact. Or 333 out of 568 patients. Then the mental mathematics starts. The audience will start calculating. What is 336 out of 553? What percentage is that? But if you say 60%, that's done, right? So even when you do the review of literature, be truthful to the fact, but don't have to quote the exact numbers. And always, you don't have to say at all. You should give credit to the authors, but that I would carry in italics, in gray, or some shade of white font at the bottom of the slide. And all your citations should be exactly as if you're citing in an article. It should follow the same format. You cannot say Arvind Moria and article. Moria A is the right format. So it should exactly be like that. You cannot, who's this? We have an intruder. So that's how it is. So PubMed, whatever you cite, it should be exactly similar citation. It should not be different. So that's how I would do the review of literature. I would even use clips of the abstract for that matter. You just take a screenshot of the abstract, highlight that conclusion in yellow, and your job is done. So when you take a screenshot of the abstract, the title and the author, everything would be there on the screenshot. That is for the audience to see. You can simply say that Shields did this study and they found that this particular treatment is effective. That is what you have highlighted in the conclusion. You don't have to read it.
So when we are incorporating any table, so we need to follow the rule of 3 again?
Yeah. Table actually should be very sparingly used in presentations. All the tables, if you are making a, say, award presentation, the best paper presentation, etc., convert all the tables to graphs or text slides. I wouldn't use a table. Nobody has time to read a table. A busy slide is most challenging for the audience and also for the judges. Take the gist of the table and put it as sentences or graphs.
And when we are comparing something like the 2 surgical technique in one slide, how to do that?
Well, I think I would say it out and use very minimal text again. In 2 surgical technique, I would say, suppose what are you comparing? Suppose you're comparing SICS with phaco. You would probably compare the time duration, complications, astigmatism, recovery time, best presenting visual acuity at the end of 6 weeks, etc. So you just have maybe say it's very simple text presentation with a central line, SICS on one side, phaco on the other side, and the parameters, and say plus, minus, or 2.3, whatever numbers, 3 hours, 2 hours, 30 minutes, 20 minutes, things like that, or astigmatism, whatever. So basically, it should be minimal words, and the difference should be very stark. It should be, the audience should be able to understand that there is a difference. That's all. Hope I
And
made
so, where would you like to see the references on the bottom of the slide?
bottom
or
of the screen, exactly at the bottom of the screen, centered or left. line in italics. And whatever you have, you must have seen many of the pictures were drawn from digital resources. So everywhere I had used a picture, at the bottom there was the acknowledgement in gray in the slides. So that's how you acknowledge. You don't have to be very bold about it. It's there in the slide. It's been acknowledged. It's from a particular source, maybe a book, maybe a digital resource. It's been acknowledged. That's it.
Sir, I have a question.
Mhm.
Like while evaluating for an award in a presentation, like it's a good case and all these rules, everything is followed by most of the presenters. Still, what gives the edge for
The
them?
overall impact. Nobody will say, okay, well, Parnas presented this good case. She had 6 words per line. She had 6 lines per slide. She had big, beautiful pictures. Nobody going to give anything. All this is to finally what? Create an impact. Impact on the judges, impact on those who are listening to you. Why do you want to create an impact on those who are listening to you? Perhaps to change their practice pattern, perhaps to get more referrals, perhaps to impress them, but you want to create an impact. So finally, everything from my first slide to last slide, if you sum it up, it's only impact. That is why you are going to present. And if you can make an impact with your presentation, that's a winner presentation. You know, you need not be the rarest of rare cases. It need not be the best of best surgeries. May not be the best of best medical outcome. But if it's an impactful presentation, then it will win a prize. Sometimes you can make the impact by the large number of patients that you have in a series. If you have, say, 5,000 patients in a series of retinoblastoma, you would have, just by the sheer numbers, you would have made an impact. Or if you have done a very nice randomized multicentric clinical trial, just by the character of the study, you would have made an impact. Compared to somebody who comes in with 44 cases from his solo practice, correct? That impact must be carried on all through your presentation by the way you have presented in the study, and also finally how you have concluded based on your data. That will be a winner presentation. I mean, judges generally go by, say, if you have 100 marks for a particular free paper, and there are 4 sections the scientific committee has given them to fill, you know, quality of the slide, quality of the presentation, relevance of the presentation, novelty, are the conclusion based on data, results, etc. They wouldn't bother filling each of those. They will just give 82 or 85 marks out of 100, and they will just simply fill everything else in random. There are very few judges I see who present every section of it truthfully. I mean, of course, they would have given you 80, that is based on the overall impact. Then how do they divide it between 4 sections? It's up to them.
So now coming to the time limit, sometimes the presentation is only of 2 minutes or 3 minutes. So that time is very less. So how to cover or to make an impact in such a less time?
Whatever is the focus that has to be said. 2 minutes to teach it's fine. I mean, you can teach in 2 minutes. If I am asked to teach the difference between a say, again going back to a conjunctival nevus and a melanoma, I would be able to teach it with 1 slide, 2 minutes. So anybody would be able to do that. If you're asked to teach how to create a astigmatism neutral funnel, then you would be able to teach it with 1 line diagram, I'm sure. So 2 minutes. Okay.
Thank you so much, sir, once again.
Yeah.
And meet next on the 6th of September. The topic being thesis therapy, turning the research mess into a magic by Dr. Sabyasachi Sengupta. See you all there.
Thank you so much, all of you.
Thank you. Good night.
Good night.
Yeah.
Thanks, Arvind, for coming.